All right, next up we have the first one that I introduced already, the Vietnam Vascular Anomalies Center, helping children with vascular birth defects. And this will be presented by Thuy Phung from Baylor College of Medicine here in Houston.
Thank you very much. I'm really honored to have an opportunity today to share with you about our work, what we have done to help improve the health of children with vascular anomalies in Vietnam. Not too many people know what these are. So I just want to give an overview of what lesions, what are the diseases that we have been helping these kids. So vascular anomalies are commonly known as birthmarks. And biologically, these are developmental congenital defects in blood vessel development and growth. And they come in many varieties, one of which quite common, and I'm sure some of you may have actually seen some of these in your works in life. One is called infantile hemangioma, and this is a picture of one of the kids in our clinic in Vietnam with a very disfiguring lower lip lesion. Another type of vascular anomalies is called port wine stains, and these are developmental malformations of small blood vessels, capillaries on the face, as you've seen here. And then a third type, which is certainly not comprehensive of all the types, but quite common also, are these malformations that can be vascular or lymphatic, and they can be very deep-seated, as you can see in that the cheek of that little infant. So these are the little patients that we would like to help. And it's an issue that we have identified, and it's an issue that we believe is an important worldwide public health problem. And the reasons are, first, these are present at birth, and they can affect up to 10% of Caucasian infants. Quite startling statistics. Second, these they are more commonly occur in females than in males, 3-to-1 ratio. And they can be quite severely disfiguring and even cause functional impairment. In Vietnam, it's a critical public health problem. And the main reasons are, first, there's really no adequate medical care for these kids in either Vietnam or even the whole region of Southeast Asia, which include Laos, Cambodia as well. And the existing diagnostic and treatment methods are quite outdated and can be even dangerous. The reason is, this is a treatment that is still going on in Vietnam, of treating these benign developmental abnormalities with phosphorus P32 radiation. Because back in the 40s, where this treatment was brought over by the French during the colonial period, they thought these were cancers. They thought these were actually cancerous lesions, so they treated them with radiation. So this is one public health problem that we would like to prevent from happening. So continue to happen. And third, the cost of treatment is quite prohibitive to a lot of these families. This is an example of a victim of this P32 radiation treatment of benign hemangiomas. In these countries, many of these lesions can actually be left untreated, and some of them will spontaneously regress. But this is, do no harm. And this is doing harm to a little child by treating this arm hemangioma with P32. And what is you see? A very severe scarring and potential of development of skin cancer later on. So facing these tremendous medical problems that these kids with vascular anomalies have, a group of physicians, including myself, got together and we established the very first Vascular Anomalies Center, or VAC, in Ho Chi Minh City. And it's a collaboration, really active and tight collaboration among physicians at the University of Medicine and Pharmacy in Ho Chi Minh City in South Vietnam, and doctors from various institutions in the US, mainly at Harvard Medical School, University of California, Irvine, a private Northwest Diagnostic Clinic here, and my institution, Baylor. And I want to point out key leaders in the group. Here you see, this is the core of our group. It's based in Ho Chi Minh City. It's run by 10 local Vietnamese physicians, and with the help of U.S. physicians. Dr. Hoang Minh is a dermatologist at the University of Medicine in Ho Chi Minh City. He's the director of the clinic. Dr. Anderson, Rox Anderson, is from the Massachusetts General Hospital. He's a laser medicine expert and has really been instrumental in teaching our clinicians in Vietnam the standard of care to treat these lesions. Dr. Martin Mim is also from Harvard Medical School at the Brigham and Women's Hospital, an expert in vascular anomalies, and has traveled worldwide and helped establish similar clinics in different parts of the world. And Dr. Nga Tran here, she and I are both partners in crime. We are both Vietnamese Americans, refugees from Vietnam as both people. And so we came to this country, grew up, got educated, and both of us wanted to go back and help our country, our people. So this is really a dream come true and also a personal journey for myself and for Dr. Tran. So that's the team. What is our mission? Very basically, two major points to take home. One is to provide safe and effective medical care for underserved Vietnamese children in need of treatment for vascular anomalies. Second, to promote active collaboration between Vietnamese and U.S. doctors to help improve the health of these children. With the help of Dr. Anderson, who is a laser expert and actually is an innovator and developed many of the technologies that laser devices use right now, we were able to acquire 4, right now actually 5, state-of-the-art brand new laser machines. Each of them can be worth up to $100,000. So here we have almost $500,000 of device donated by this laser company to Vietnam, to our clinic, to help treat patients. We can talk about later of how we actually got to that point, but charity really starts at home. And so we have this treatment room, and we can actually treat these kids right away. So this is actually in our first year. We opened in 2009, and this is Dr. Rox Anderson training Dr. Min right there on the laser therapy for a child with vascular anomaly. So I would like to show you what is the outcome. So we have done this work. Really, what have we achieved? This is a scenario, a case of a little boy with a lower eyelid hemangioma that can cause blindness if it's not treated, as you can see there. His mother took him to the clinic, and 4 months of treatment with steroids and laser, which are the standard therapies that we have helped train our doctors there. See, the lesion has actually significantly improved, and today you can hardly see it. So we have saved, by timely intervention, this boy's eyesight. And this is just one of many examples of kids that we have helped over the years. So the key accomplishments of our clinic in our brief 4-year history: public health, number 1. We have actually successfully campaigned hospitals in Vietnam, in Ho Chi Minh City in particular, to stop treating hemangiomas with P32. So I think it's a really important public health advance in this area. In patient care, we have established this first VAC clinic. We have acquired multiple lasers. We can actually effectively help these kids. Our clinic operates twice a week, every week of the year. This is where community participation and training and working with community doctors help us. We go there once a year. I have a full-time faculty appointment at Baylor. Very busy, but I go there once a year. And with that 2-week trip or so, we can actually make a big impact by educating the doctors in Vietnam. Over the past 4 years, we have helped over 3,000 kids and actually treated by laser or medication 700. You cannot just treat and leave it. In order to continue our progress, we have physician education. Our doctors provide hands-on training for Vietnamese doctors, and we also sponsor Vietnamese doctors to come train in the US. So our future goals, I just want to briefly say, we want to expand access to older patients and to other parts of Vietnam. We want to build capacity by providing education to treat with beta blockers and laser, which are standard therapy. And we also got patients with other lesions that came to see us, besides vascular anomalies like pigmentary lesions, vitiligo, and scar. This one is from P32. We also, for the interest of the students and the residents in the audience, we sponsor student exchange between institutions here in the US. And lastly, we want to promote public health to continue public awareness about P32 danger, and we want to conduct clinical research on vascular anomalies in Asian population. So I want to close by showing you a picture. Vietnam is a beautiful country. It's not a war-torn country like the public media like to display. This is Ha Long Bay in North Vietnam. So if you're interested in it, you're welcome to come talk to me. That's my email. And we have a very active website called vietnamvac.org. And I would like to close by telling you that we really appreciate the opportunity, and we hope that we can expand our work to involve the interests of the Houston community as well as in Texas. So thank you for your attention, and maybe we have or not have time for questions.
One quick question.
Thank you. I have visited medical bridges where it's a medical supply, and we want to expand to include surgery, and they do definitely would be a good resource, and that's definitely. I just found this brochure about the conference in the TMC News, and it reads, there's a quote from the anthropologist Margaret Mead: "Never doubt that a small group of thoughtful, committed people can change the world. Indeed, it is the only thing that ever has." And I think throughout this conference, since 9 a.m. this morning, we have heard that the power of individuals and groups of individuals can really make a difference. So, to the students and the residents and the doubters of, can I do anything by myself? I think it's a strong message from this. And I also have some brochures about the Vietnamese clinic. You can feel free, it's a flyer to get more information. Thank you again for your time.